Hey everybody, welcome back. Luke here, Mobility RX. I'm going to talk to you guys a little bit about knee pain. Knee pain is debilitating, yes, and can take people away from their livelihood. And so I want to help with that population that's dealing with knee pain. Knee pain is probably one of the areas that we should have the least amount, but it seems to be climbing because we have a repetitiveness of our daily activities that continue to drive us into overworked and underworked muscles that get us out of balance. And when we come out of balance, the body's then compromising or trying to help guide what you're asking it to do every day by just surviving and keeping the body moving. And what I mean by that is that if I'm in a car every day or if I'm standing every day a certain way, it is a joint that is made for hinging. It's not made for rotation. And a lot of times, the repetitiveness of our daily activity, we're not even talking about sports, we're talking about just the daily activity, 9 to 5, will put us in this repetitive movement pattern that starts to create an imbalance from our what we call a sequence of mobility and stability areas that we look at currently now. And I got a little poster behind me, and real quickly I'll tell you there's a balance that should be, and if this is out of balance in any way, shape, or form, this is what's going to give you the debilitating pains that we're talking about. And real quick, the way that is it's based around a mobile, stable environment that we are not myself, but people have discovered along the ways of us evolving into this wellness field, and that goes simply put like so. So knowing the joint of the ankle, it rotates and can do all of the movements very, very similar to your wrist. Okay, so you got rotation in there, you can flexion, extension, deviation. It can do pretty much all of those types of things, but it is going to be more of a fix because it's standing and it has weight bearing on that, where the wrist doesn't really have weight bearing. So the wrist probably has a little bit more movement patterns, but there's 26 bones in the foot and over 100 muscles and tendons and ligaments within the foot. So a quarter of your bones are in your foot, and that is where all of this starts. So we'll look at that really quickly. We're going to look at the ankle being a mobile area, the knee being a stable area, the hip femur socket should be a mobile area, the pelvis complex should be a stable area, thoracic region should be a mobile area, stability within the scapular region, mobility in the shoulder region, rotation again, stability of the neck. If any one of those is compromised or have shifted due to an imbalance of the muscular system, then that's where people are finding themselves with this knee pain that we're talking about. So getting back to the subject, the knee hinge, it has to have pretty much from your gait, there should be some type of a gap in there that allows it to smoothly glide back and forth in this hinging range of motion that we're talking from. If it starts to glide with a little bit of a torque or rotation, that's when you're going to start to see the inflammation or inflammatory response takes place based around, hey, I'm not supposed to be doing that. The histamine starts to kick in, and it starts to send some helpers down saying, hey, here's some extra collagen, what do you need to heal us up, let's get it feeling better. But that's not the case. We go right back into our 9 to 5 job, we find ourselves in a seated position, and we start to lose range of motion out of our femur, the mobility there, or we're losing range of motion out of our ankles. Whatever the case might be, we have to look at either up or down. I look predominantly at the foot first and then work my way up, of course. The biomechanic would state that, biomechanically tells us that. So I look at that, and if there is a problem, we'll try to correct it. If there's not, then we'll go to the femur, of course, which would be the second area. But anywhere in there is thrown off, well, it's going to go directly to the knee. So how can I prevent that? Well, there's numerous ways to do this. One easy, quick way that I can try to help you with is just activating the glutes. Get those firing glutes to fire back to when you're a little child. So when you look at the squat pattern, how does that externally, we got to external rotate, internal rotate to get those glutes to fire, the glute medius in particular. And how do I get those glutes to fire? Well, you can isolate them by laying on the ground and isolate the glute, but that's not as functional as something that if you're standing or you're doing something that would be relative to our nature, right? So just a general squat, if you can't get into that squat, then there's an issue. Meaning if you can't get rock bottom, you can't get full hip hinge, knee hinge, there's a problem, because we don't want to go to 90 degrees all the time and strengthen the muscles just at 90 degrees. Now that joint of your knee is going to be compromised. It's going to strengthen up the muscles around the knee that only wants to go to 90 degrees. Then your gait or your gapping becomes very, very rigid and very, very stiff. And what I mean by that is you have a certain amount of cartilage in between. I think about it like that as the sole of your shoe. And if I am compressing that enough and squeezing it enough, I'm going to wear that out. So I need to have a nice glide to it. I need to have enough gap in between there that would just glide over top and not put this grinding effect. And so we want to look at that, and that will sum up your knee pain right away just by saying, hey, am I able to get in a full squat like I naturally would? Natural squat, not a 90 degree cute little desk sitting down when we're little. I'm talking about a full on squat, hips all the way down. Can you get your hips all the way down to your ankles and stay in that position? If you can, your knee is going to open up all the way. You're going to get full range of motion out of your knee. You're going to get range of motion out of your ankles. You're going to get range of motion out of your hips. Your back's going to be in a much better position. The curvature of your spine will be in a much better position. If that's not taking place, then you got to have somebody like myself try to help correct that. But one exercise I'll leave you with that may help with the knee, and that is if you can get a mini band like so, and you can put this around your ankles or around your knees, and you can try to get some external rotation. That will start activating those glutes. If you can get activation out of the glutes, and you can use it from any standpoint, you can do it with just laying down and doing like a calisthenic abduction. You know, you can activate the glute. If you can get activation out of that glute, you're going to have stability, a lot more stability in your externals, which then will help you guide you down into that squat. But if you can't get down there, even after doing that, then you got to look at your ankles. You got to see other things going on. Another topic for that later on. I'll try to cover that segment. I think I've covered it a couple of times, but we'll go back over that. If you haven't already, hit me up on YouTube. Subscribe to YouTube. I'll continue to post. Take a look at some of the postings I've already done on YouTube. Like me on Facebook. I'll continue to post these exercises and talks about trying to help you guys with what I see on a daily basis. And of course, if you have any questions, feel free to email me. That's mobilityrx@gmail.com, mobilityrx@gmail.com. And I'll be seeing you next time with any questions or concerns that might be coming up. Talk to you later.